My name is Susan Sceta. The main reason why I came was for the upgrade of my heart, which has had a pacemaker since 2016 when I had a stroke. And I was advised by my doctors in Zambia that I needed to come here to Apollo Hospital for the upgrade.
Patient Susan Sceta, a very pleasant lady. She's a survivor of sudden cardiac arrest. In 2014, she went to Netherlands for a holiday and there she collapsed, and then ICD was implanted since 2014. Her dilated cardiomyopathy, it progressed, and her ECG showed left bundle branch block, which is a abnormality of the conduction system which develops in about 30 to 40% of patients of cardiomyopathy. Dilated cardiomyopathy in females, in case it is treated rightly, can reverse the heart function back to normal or near normal.
So the main problem that there was that the pacemaker's life was expiring. I needed to come and have a new one inserted in my heart.
So when I saw this patient, I analyzed her symptoms, I analyzed the entire data, ECG, echo for her, and then I thought she was a good candidate to get the benefit of cardiac resynchronization therapy along with the new modality of pacing, that is the conduction system pacing. In conduction system pacing, we attach an additional lead to the conduction system to normalize the ECG of the patient. This is like an electrical bypass. So Susan received a combination of cardiac resynchronization therapy and conduction system pacing, which is known as LOT CRTD, that is left bundle optimized therapy, along with cardiac resynchronization therapy and with the defibrillator.
Dr. Vanita is the doctor who has done all this, inserting a new pacemaker in my heart, which is much more effective and stronger and modern than the one that was inserted in the Netherlands when I first had it.
And she did very well. She improved very nicely and went back home.
And according to her, it will make my heart function more effectively.
In case you are a case of dilated cardiomyopathy, please talk to your cardiac electrophysiologist. At Indraprastha Apollo Hospital, we analyze the patients in detail and meticulously to give them a better result from the modality of therapy, that is cardiac resynchronization therapy and the conduction system pacing. The combination works very nicely and gives the patient a real hope of life.
Thanks to her and thanks to God who has used her in this mighty way. I shall forever remain grateful to her and all the staff who have been working on us.
Our experience here was very good. We had the privilege to enjoy good facilities. The staff here was very helpful, and any queries that we had were attended to very quickly.